Ms. Smith. Can you speak to some of the emerging challenges and opportunities in the management of myeloproliferative neoplasms?
Well, a lot of the world of MPNs is starting to explode, especially with myelofibrosis. We're getting all these different treatments, these trials running, things hopefully that we will have that could change the disease, process in these patients. And so I think one of the biggest challenges is that where do the patients fit at in this aspect of it? Where, like, are we gonna be able to actually get patients, approved for some of these things, or will we have to go with the old oldie but goodie with a lot of these? We still use Hydrea, a lot in these in MPNs. And so, but we have a lot of other drugs now that we can use. But because we know that it's a tried and true, and it's harder to get patients on some of these other drugs, we go with the oldie but goodie. So I think that's a challenge that we'll have. And the other thing is too, these drugs are expensive. So even if we can, get the drug for them at our institution or in the community, if we can get them for them, will they be able to afford them? And one thing I can say that I've noticed is a lot of the drug companies, that we've dealt with here, that they are really good about helping, like, is there anything that we can do to kind of help push the process to get patients, assistance for these therapies. And so I think that's one of the biggest challenges that we'll have with treating them, just this explosion of new therapies coming.
And you kind of alluded to it when you spoke about Hydrea. So I'm going to pose this question to you, Dr. Jain. Are there any unforeseen or outdated practice-related barriers or therapeutic inertia that may hinder your work and that of your colleagues?
Yes, definitely. I echo Ms. Smith's sentiments. I think a lot of times, things that we've already used for years and having familiarity with those treatments sometimes can lead to resistance to accepting new guidelines and treatments. And that can come from, again, not knowing the side effects that these treatments can pose, right? Not having long-term data that these drugs haven't been, some of them are new, they haven't been around for years, so we don't know what they can cause in the future. And that can happen both from the healthcare provider standpoint and also from the patient standpoint. So that it can be challenging. And what can help us overcome that is education. Even though the drugs might not be approved, for example, the newest approval that came around last year was momelotinib, which is a newer drug for myelofibrosis, can help treat anemia as well. After it was approved, we had patients ask us for that drug for months before we could actually prescribe it, because yes, FDA approval and then actually being able to prescribe the drug takes some time for these drugs to show up on formularies, for pharmacies to start carrying them. And then going back to, even if the drug was approved last year, it doesn't mean it's a new drug. It's being tested, and it is being tested in trials for years now. So those are some of the things that I can think of.